Most dog owners panic instantly if they see their dog snap at a bee or wasp. And honestly, that reaction makes sense because the situation can turn serious much faster than people expect. Some dogs get stung on the paw and recover fairly quickly. But when a dog swallows a bee or wasp, the danger level changes completely because swelling can begin inside the mouth, throat, or airway where owners cannot easily see it. That is why veterinarians take these situations so seriously. A sting inside the mouth or throat can become dangerous very quickly if swelling starts restricting breathing. One thing many owners do not realize is how common this actually is. Curious dogs often try to bite flying insects during play, especially younger energetic dogs. And unfortunately, many dogs learn the hard way that bees and wasps fight back. The problem is that once the sting happens inside the mouth, owners may not immediately understand what they are seeing. One moment a dog is playing normally. Then suddenly the dog starts pawing at the face, drooling heavily, gulping repeatedly, or acting distressed. Some dogs panic immediately after the sting. Others become strangely quiet, restless, confused, or uncomfortable within minutes. One thing that makes these situations dangerous is how quickly swelling can develop internally. Owners often wait too long because the dog still appears mostly okay initially. But airway swelling is not something you want to gamble with. And honestly, this is one of those situations where fast action matters enormously. One moment completely changed how seriously I take this issue. I once saw a dog that seemed only mildly uncomfortable after chasing a wasp outside. At first, the owner assumed the dog had simply irritated its mouth slightly. But within a short period of time, the dog started drooling heavily, struggling to settle, and showing visible difficulty swallowing. By the time the swelling became obvious externally, the situation had already become far more dangerous internally. And honestly, it happened much faster than most people would expect. That is why veterinarians constantly warn owners not to wait and see too casually with mouth or throat stings. Swelling inside the airway can become an emergency very quickly. So what should you actually do if this happens? The very first thing is stay calm enough to assess breathing carefully. Panic helps nobody in these situations. Watch your dog closely for signs like excessive drooling, frantic pawing at the mouth, swelling around the face, repeated gulping, wheezing, noisy breathing, coughing, vomiting, agitation, sudden weakness, pale gums, collapse. If breathing looks affected in any way, contact an emergency veterinarian immediately. Do not wait for symptoms to worsen first. One thing many owners underestimate is how difficult it can be to see swelling inside the mouth. The outside of the face may still look relatively normal while internal swelling is increasing. This is why repeated swallowing or noisy breathing matters so much. Those signs may indicate swelling deeper in the throat area. Another important thing veterinarians recommend is checking whether a stinger is visible if your dog allows you to safely look. Sometimes stingers remain lodged in the lips, gums, tongue, or mouth tissue. If you clearly see a stinger near the surface, vets often recommend carefully scraping it away sideways using something flat like a credit card edge instead of squeezing it with tweezers. Squeezing can release more venom. But if your dog is distressed, painful, reactive, or you cannot clearly see the area safely, do not force the inspection. Getting bitten while trying to look inside an injured dog's mouth is extremely common. Another thing many people misunderstand is the difference between normal localized swelling and an allergic emergency. Mild swelling around the lips or muzzle can happen even without a full allergic reaction. But severe swelling, difficulty breathing, weakness, vomiting, collapse, pale gums, or rapid worsening symptoms require immediate veterinary care. And honestly, allergic reactions can escalate frighteningly fast in some dogs. Especially if the sting happened inside the mouth or throat. One major mistake owners make is giving random human medications without veterinary guidance. Some medications can be dangerous depending on dosage, the dog's size, underlying conditions, or what exactly was swallowed. This is why calling a veterinarian quickly matters so much. Even if symptoms seem mild initially, professional guidance helps determine whether monitoring at home is reasonable or whether emergency treatment is needed. Another thing vets frequently warn about is delayed worsening. Some dogs appear relatively stable at first before swelling increases later. That is why observation matters closely for several hours afterward. Owners should continue monitoring breathing, swallowing, swelling, behavior, and energy levels carefully even if the dog initially improves. One thing that surprised me when learning about this issue was how often dogs repeatedly try catching bees or wasps even after being stung previously. Many energetic dogs simply do not connect the danger immediately. This becomes especially common in highly prey-driven or playful breeds. Movement itself triggers chasing behavior automatically. Another thing many owners overlook is how painful mouth stings can be. Even without a dangerous allergic reaction, the dog may still feel significant discomfort inside sensitive tissues. Some dogs become clingy afterward. Others become restless, withdrawn, or unusually quiet. One thing veterinarians emphasize repeatedly is avoiding unnecessary delay when throat involvement is possible. Mouth and airway swelling simply carry different risks than a sting on the paw or body. This is especially true for smaller dogs. Smaller airways can become compromised faster if swelling increases internally. Another huge warning sign is sudden lethargy after a sting. A dog becoming weak, collapsing, or unusually still after swallowing a bee or wasp should never be ignored. That may indicate a severe allergic reaction developing rapidly. And honestly, those are situations where immediate emergency care matters most. One thing many people do not realize is that wasps can sting multiple times while bees usually sting once. Depending on what happened inside the mouth, irritation and venom exposure can vary significantly. That is another reason professional evaluation matters if symptoms begin escalating. Another important point is preventing secondary accidents during panic. Distressed dogs may bolt, choke, snap reflexively, or struggle unexpectedly during inspection attempts. Owners should focus first on keeping the environment calm and safe while assessing breathing carefully. One thing dogs constantly remind humans is how quickly normal playful moments can suddenly become emergencies. And honestly, bee and wasp stings inside the mouth are one of those situations where recognizing danger early can make an enormous difference. Most dogs recover well when owners respond quickly and appropriately. The biggest risk usually comes from delayed recognition or assuming symptoms will automatically stay mild. Ignoring these signs can lead to severe complications, as even mild swelling can obstruct airways or indicate serious underlying issues. Always consult a veterinarian immediately. In conclusion, vigilance regarding any symptoms of mouth or throat swelling in pets is crucial, as swift action can ultimately safeguard their health and well-being, preventing potential crises from escalating. If your dog ever swallows a bee or wasp, the most important thing is not panicking blindly. It is recognizing the warning signs early, monitoring breathing closely, and getting veterinary help fast if symptoms begin escalating. Every second counts in an emergency, so stay alert. Stay proactive and prepared. When you notice unusual behavior or signs of distress, don't hesitate to act. Your instincts are vital. A rapid response might mean the difference between life and death for your beloved pet. Remember, staying calm can help you make better decisions under pressure.